Kia ora, talofa malo alei. This is so cool. The answer to that question is in this room. You are actually the answer to this question, how we're going to scale prevention is cure. In the next 20 minutes, I want to cover 3 questions. I want to try and answer 3 questions. Easy. What is our why as humanity? What are we here for? What are we striving for? Question 2, what needs to change? And question 3, how will we get there in the next 5 years and at scale? So the first question, why are we here? We want to live good lives. We want to feel good. We want to function effectively. Of course, this is the concept of well-being. If it's not well-being for ourselves and others that we're striving for, then what is it? What is it? That is our why. So, can I ask you all to please, if you want to live to be 100 years of age or older, could you please stand up? Awesome, thank you. Stay standing, stay standing, stay standing. Good to know some people quite happy not to live to 100. Stay standing. If you want to live to 100 years of age or older without the use of your legs, stay standing. Feel free to sit down. If you want to live to 100 years of age without your hearing, your vision, with cardiac and pulmonary dysfunction, I still think many of us are okay, but what about without knowing who you are, with dementia? What about when your loved ones, you don't know who they are? I don't think many of us want to live to 100 if we don't have our health. And this is the concept of health span. We want to live healthy and well for the last 20 years of our lives. But what we do right here and right now, we are laying down the foundations of how we will spend the last 20 years of our life. Because here at PREKURE, we want to help people die young, as old as possible. Here in Aotearoa in Australia, we die oldish and we die full of chronic disease, preventable disease, lifestyle disease. We can do better than this. Prevention before pills. Currently, every single health system in the world is crushed by the burden of disease. So what's going wrong? Because on one hand, we have what science knows, and on this hand, we have what practice does. Common sense, common knowledge is not common practice. So that brings us to the second question. What needs to change? 3 things need to change. If we understand that our why is for well-being and feeling good and functioning effectively, then what needs to change? First of all, prevention is cure. An ounce of prevention is worth a pound of cure. Treatment without prevention is ultimately unsustainable. We know that the best value for money investment in health is in prevention. How much do we spend on prevention in our healthcare system? When we talk about prevention, we talk about primary prevention before disease even begins. Secondary prevention, which is when we first see the signs of disease. And tertiary prevention is when we slow down the progression. We do spend money in tertiary prevention, and we spend some in secondary prevention with our screening programs and things. There is a very, very small amount of the healthcare budget spent on primary prevention. We need to change that. Prevention is cure. Lifestyle is medicine. It's clinically sound. It's evidence-based. It's not woo-woo. It's not complementary, alternative, whatever you want to label it. It is medicine. The food we eat is our medicine. The movement we do or don't do. We know this stuff. We have been expertised, pharmacised, big fooderised. The power of my health has been taken out of my hands, and someone else is supposed to fix it. Someone who knows better than me. What needs to change? That needs to change. The power of our health has to come back into our own hands. And we do that through lifestyle. The third thing that needs to change is our health workforce development. We do not currently have a health workforce that is designed for prevention. I think health coaching and mental health coaching is the workforce of the future. What happens with health coaching? Well, health coaching is like when Harry met Sally or Wendy. You have to be old to know the movie. What do I mean by that? Health coaching is the knowledge and the science. And you pair that with behaviour change. And you bring those two together and you get magic. You get well-being. And that's what we're trying to do. Knowledge on its own is not enough. Behaviour change without having the latest evidence and science and knowledge will only get so far. So let's do them both together. So coaching is really powerful. Number one, when we coach, we stay on the patient, the client, the person's agenda. It is all about them. It is not about us. We ask about their whānau, about what has happened to them. We stay on their agenda. We reserve judgment. Now that is very hard to do as a human. For a moment, think about the last time that you felt judged. When was the last time? It was probably in the last day or week. When was the last time you felt judged? How did it make you feel? It feels sad and mad, and it doesn't feel good. And behaviour change does not come from a place of judgment. But all of us, we're just human. We all judge other people. So how do we not judge? We stay curious. We ask questions. That is how we reserve judgment. We ask powerful questions. This is what a health coach does. Powerful questions are short. They often begin with what? What does starting look like? What do you think you could do? We never take agency away from the individual. Powerful questions. There's one powerful question that I know the health coaches in the room will use a lot. It's really simple and it's really short. And it's simply, what else? When someone's talking and they stop and you think there's space and there's silence and it's awkward, that's okay. You're allowing the person to hear what they're thinking. You're allowing them to navigate what's going on. You're giving them clarity. So we stay on their agenda. We reserve judgment. We ask powerful questions. We listen deeply to the words, to what's not being said, to the body language. And then once we've done all of that really well, maybe sometimes we can give advice, or in health coaching, we set it up as a challenge. A couple of years ago, I was down at the Ministry of Health in Wellington, and can't remember the exact forum I was in, but was on a stand. And a lady came up to me and started talking, and her name was Maria. And Maria, I could see that she was upset. And we just said, hi, how are you? Started talking. Because I could see she was upset, I did my health coaching. And it turned out she'd just come from the doctor and she'd had a diagnosis of type 2 diabetes. And she was really upset by it. And she'd been told, nothing you can do, progressive disease, you'll be on this medication for life. And we went through the first 4 steps of health coaching. And then after a while, she talked to me about what she ate for breakfast, and it was Weet-Bix and milk and fruit, and at 10 o'clock she'd have a muffin, and she had sushi for lunch, and sushi's healthy, and off she went. And I said to her, can I give you a challenge? And you can say yes, no, or counter offer. So when we present a challenge or information, that is how we do it as a health coach. You can say yes, no, or counter offer. And we don't mind what they're going to say. We don't judge. If they say no, that's fine. We move on to the next question. So I said to Marie, can you tomorrow for breakfast, would you be able to do an egg omelette with some veggies in it? She thought about it and she said, yes. Yeah, I'm going to give that a try. And then I said to her, so how would you like to be held accountable for doing that? And she thought about it and she said, can you give me your phone number and I'll text you? So, sure. Gave her my phone number. And the next day she texted me and said, I had eggs for breakfast. So the 7th skill in the health coaching, amongst many others, is championing, because it's coaching. So I went back to her and I championed Marie and I said, good on you, that's great. I've got another challenge for you. You can accept, reject, or counter offer. For the next week, could you have that breakfast every day? And she came back and she said yes. Now, Marie and I worked together over text message in that way for 3 months. By the end of the 3 months, in her time, on her agenda, she transformed her diet. Didn't have to go on that medication. And that's the power of health coaching. But it must be set up properly to begin with. So health coaching, mental health coaches are the workforce for prevention. They ask, they don't tell. They never take the power or agency from the individual. Health coaching looks to the future. And I think what's really important is sometimes our health coaches are told, you don't know enough. You haven't gone to university for 4 years or 7 years. You're not good enough. Bollocks. rigorously trained health coaches who have been trained in coaching and lifestyle medicine, you do know enough. You do know enough. So we are living in changing times. Let's, in 2027, let's aspire to live long and drop dead. So we know why we're here. We know what needs to change, but how are we going to get there in the next 5 years and at scale? So I think there are 5 paths to prevention. We've got to start with the government. The government is very powerful. They represent us, the people. We can do all sorts of things. We can fundraise money, we can do things. The government controls the healthcare budget. We must lobby and do what we can to get prevention at the forefront of making decisions. Let's face it, we spend billions on sickness and very little on health. We have to make it clear to our politicians that we are sick of the deficit model of healthcare. We want the abundant, the positive medicine approach. I've been hearing a lot in the news lately about the supply issue. We don't have enough GPs. We definitely don't have enough registered psychologists. And training up health coaches, mental health coaches, is one part of the solution on the supply side. But what are we doing on the demand side? Those food guidelines that Brendan showed us. What are we doing in schools? We've got to get the demand for healthcare down. We need to do more on the demand side. So this deficit model of health is about a lack of health. Martin Seligman, the father of positive psychology, said that psychology aims to make miserable people less miserable. Doctoring aims to make sick people less sick. It's time we changed. To advance population health, we must PREKURE. That is, prevent ill health and optimise for well-being. It is time to change. This Maori proverb says that we are all in the same boat. Of course, that's not quite true. We're all in the same ocean, as Sir Peter Gluttman said, but we are in different boats. Some of us are in walkers, on surfboards, in canoes, on yachts. But we all want whole person health. The Maori model of Te Wharu Tapua, the Pacific models of health. We need to train the health workforce where they are. The whānau and iwi have brilliant people who can be trained and are willing to train and help the whānau and the communities that they're in. Who is a young Maori boy going to listen to more than the, white female skinny dietitian that flies in from Auckland, or auntie, or the elders? We can train for technically able and culturally relevant whole person health in the communities where we live. So I don't believe that the solution is in training more GPs and more registered psychologists. Absolutely, let's do that, but that'll take 7 to 10 years. Let's train our people in our communities, because that is where we will get long-term sustainable behaviour change. This is the first graduating class of health coaches and mental health coaches from the Pacifica Medical Association. They're ready to go and help and change in their communities. We need to stop putting up barriers. Sometimes there is patch protection happening, particularly in dietetics, particularly in psychology. Sometimes we're told you're not clinical enough. Bollocks. We've got to stop putting up barriers and find solutions. So culturally aware and technically able, paving a new way to surf the waves of mental health. Mainstream medicine in New Zealand today does not meet the needs of Pacific people, or Maori, or Pākehā for that matter. So 5 paths to prevention. Health insurers are stepping up. They really are. NIB, AIA, Southern Cross. They're understanding that they have a part to play. Employers are stepping up. We've moved past the green smoothies and fruit bowls on Friday and yoga at lunchtime. Those are all good things. But none of that will take away from having a boss that doesn't care, from being expected to work 60 and 70-hour weeks. That is stressful. That will lead to burnout. Employers have a part to play, and it is more than lip service. It's more than green smoothies, fruit bowls on Fridays. It's about not having overwork. It's about caring. And the 5th path to prevention, I believe, is through purpose-led businesses. Purpose-led businesses have a point of view. They stand for something. They want to put a dent in the universe. They have a sense of urgency. They often deliver a social dividend, and they have a commitment strategy, not an exit strategy. So there are many purpose-led businesses in this room. And what I want to do is say, there are 3 questions now for you. Before I ask you these 3 questions, I'd like to tell you what we're going to do. PREKURE is going to train 50,000 new health professionals in lifestyle medicine and coaching by 2027. I'd like you to hold us accountable. At this conference, every year, we will tell you how we're going. We're delighted with how this conference, we'll be putting it on again next year in November in 2023. It will grow and it will be bigger because this is mainstream medicine. This is not alternative. So to help us do that, I have 3 questions for you. What are you going to do? When will you have this done? And how would you like to be held accountable? I know there are some brilliant people in the room. Lee Tan, give us a wave. Lee is setting up an amazing new model of healthcare in Dunedin with an amazing team around her. If you get a chance, go and talk to her. I know there are many other examples of this. You're going to hear from Dr. Glenn Davies after lunch. But I want to say, if it feels hard when you go out there and you want to make change, and it feels really hard and you get disheartened, it's because it is hard. It's not because you don't know what to do or you don't know enough or you don't have enough degrees. It's because this is hard. We're trying to do something no one has ever done. We need passionate and committed people. That's you guys. You are how we will scale prevention is cure. Thank you very much for being here.